Naren.
Good afternoon, everyone. I'm Dr. Akhila. Today, we are going to talk about thyroid and its impact on reproductive health. So, thyroid is an endocrine organ which helps in the body metabolism and also helps in reproduction. So, it is situated in front of the neck and it secretes the hormones T3, T4, TSH. And in women, it helps in ovulation, it helps in menstrual cycle regulation, and thus helps in fertility. In males, it helps in spermatogenesis as well. So, what we must understand is it is much more common in women than in men, which is the problems in thyroid are more common in women. And what are the problems that we are actually looking at is there are two set of problems. One is an underactive thyroid, the other is an overactive thyroid. And also the treatment once given, it comes back to normalcy quite quickly, and therefore fertility can be planned easily after that. There are two, like I was telling, there are two sets of problems. One is the hyperthyroid, the other is the hypothyroid. Now, hyperthyroid would mean an overactive thyroid, which means that T3 and T4 are high and TSH is low. Hypothyroid is the other way, that is T3, T4 are low and TSH is high. This is because of the negative feedback mechanism that we have. And how do we diagnose these problems is by doing a simple blood test wherein these hormones are detected, the values are detected, and based on that, we come to a diagnosis as to which is the problem or is it normal. It is important to understand that these tests are to be done in a fasting state. Now, let's quickly understand one by one. First, let's talk about hyperthyroidism. It is less common than hypothyroidism, and this is the overactive thyroid, wherein the T3, T4 levels are high and TSH is low. And in women, it causes problems in as irregular cycles, that is, scanty and shorter periods, therefore causing anovulation, that is problems in ovulation, and it can also cause miscarriages, fetal growth reduction restrictions in babies. It can cause high blood pressures, that is hypertension in pregnancy. These are some of the disorders that can happen because of hyperthyroidism. And in males, it reduces the sperm count. It also causes decrease in the quality of the sperm. These are the issues that can happen in men and in women with hyperthyroidism. What is the treatment to it? This is in the form of drugs, carbimazole or propylthiouracil. Propylthiouracil is preferred as it has lesser side effects than carbimazole. The side effects that we are looking at is agranulocytosis, and some of these can cause even fetal birth defects. So, the dosage of these drugs and how to when to change and whether to stop or continue during pregnancy, after all this needs to be discussed with your physician. Surgery, if required, needs to be done in the second trimester of pregnancy, and radioactive iodine as a treatment is absolutely contraindicated in pregnancy. So, this is about hyperthyroidism. Now, coming to hypothyroidism, which is more common than hyperthyroidism. Now, this state is an underactive thyroid, which means the TSH levels are high and T3, T4 are low. Now, what happens in women is they can have prolonged cycles, which again causes problems in ovulation and therefore can lead to infertility. In males, it can cause problems in sperm motility and in sperm morphology. So, treatment is essential in both men and women. Like I always say, fertility is just not a woman's problem, it's a couple's problem. So, TSH needs to be tested and it needs to be normalized in both men and women. Not just for fertility, but even the basic body metabolism also gets affected. So, the TSH value that we are looking at is less than 2.5 is the target that we have, and we maintain this for women who are trying to conceive and in their pregnancy state. Now, for women who are hypothyroid, the treatment is in the form of levothyroxine drugs that we give. There is another clinical entity called as subclinical hypothyroidism, which means that the T3, T4 levels are normal, but TSH is high. So these kind of women also need to be treated if they're infertile and to help them with fertility. Once the drugs are taken, fertility and ovulation and menstrual regulation comes back to normal quite early. And the other test that we normally recommend for women with hypothyroidism or subclinical hypothyroidism is anti-TPO antibody test. So when women are positive, it is an indication of an autoimmune disorder, and this just means that these women are at a higher risk of miscarriages and they need to be treated. So when the woman is autoimmune positive to anti-TPO, but her TSH levels are normal, it is not an indication to treat these kind of women. Very important to understand. And what are some of the other things that we can do on a routine to prevent these thyroid disorders as preventive measures? Is that to reduce the stress, healthy diet, and exercise. These are the three things that can bring your hormone levels to normalcy and prevent these kind of disorders. But once they are detected, it is of paramount importance to treat them, because this is to test these thyroid, these TSH T3 levels is one of the first steps to fertility. And treatment is very simple in the form of drugs, which needs to be taken. So this is about thyroid and how it affects fertility. Thank you so much. Any questions, please? I gained a lot of weight recently and now have enormous mood swings throughout the day. What should I do to control both? So, this needs to be checked as to why there is excess weight gain and why there are mood swings. Also, if one of the reasons is definitely an abnormal thyroid, that is most likely it is a hypothyroid state, but the others also need to be tested. And after testing, appropriate treatment, and like I already mentioned, exercise and healthy diet are of paramount importance. If the TSH levels are high, levothyroxine is the drug of choice. Yes, thyroid has an effect on menstruation. Like I said, if it is a hypothyroid, the menstrual cycle is prolonged and there is anovulation, that is, you get your periods more than 35 or 40 days later. If you are hyperthyroid, the cycles are shorter and scanty, the flow is less. So, this is how the thyroid affects the menstrual cycle and regulation, and thus affecting ovulation. Once you know that there is no ovulation, it obviously means that there is a fertility issue. I maintain a healthy lifestyle by eating balanced meals and exercising regularly. Now I've been diagnosed with thyroid. What could be the reason behind it? How do I manage it effectively? So, thyroid doesn't essentially mean that it's a lifestyle disorder. It typically means that the thyroid is not functioning appropriately. So, what normally happens with food is the kind of food that we take, suppose iodine rich salt and other things, the iodide from the food is absorbed by the intestine, and that goes and acts on the thyroid. The receptors take in, and this iodide combines with tyrosine, which is there in the thyroid gland, mixes with the iodide and forms monoiodotyrosine or diiodotyrosine. When mono and diiodo combine, it forms T3, and when two diiodotyrosines combine, it forms thyroxine, which is T4. This is how the diet plays a role. Now, this T3 and T4 are what are essential. If the T3 and T4 are less, TSH increases, the pituitary increases these as a feedback, negative feedback mechanism. If the T3, T4 are low, TSH increases, T3, T4 are high, TSH decreases. This is how the mechanism is. And so one balanced diet, apart from the balanced diet, whether it is iodine sufficient or no is something we need to check. Even if everything is in place, it is the thyroid that may not be functioning properly, which could be an autoimmune problem, and that needs to be tested. And once you get these tests based on how the levels are, drugs can be offered accordingly. What is the normal thyroid level in females and which level affects fertility? So the level that we are looking at is less than 2.5 for women who are looking at fertility, who want to conceive and who are pregnant. So this is the level we are looking at to maintain it, less than 2.5. This is a little less than the usual targets that we have. That is because in fertility we plan to have TSH levels lower, which improves the fertility rate. Thus, thyroid cause tiredness and horrible periods. Yes. So, hypothyroid is a state where you feel lethargic, you feel tired, you feel lazy, and you can have cold intolerance along with prolonged periods. Sometimes it can be heavy periods because they are prolonged. These are all some of the symptoms of hypothyroidism, which can be treated by taking levothyroxine. These medicines are to be taken early morning, empty stomach. That needs to be noted. How thyroid issues affect male fertility? Like I have already mentioned, thyroid can affect males as well. And if it is hyperthyroidism, it can cause decrease in the sperm count, and the quality also is decreased. If it is a hypothyroidism, it can affect the motility and the sperm morphology. Thank you. Thank you so much.